first I would like to ask for your permission to use this video for educational purpose and I need to know.
Sure can. Yeah.
How was your life before the surgery? Tell me a little about it.
I was a real active person, all my life.
Mm-hmm.
But probably the whole last year, I couldn't hardly do much anymore, and it just got to where I just couldn't. There was no quality of life. I couldn't do anything.
How bad was the pain?
It was pretty bad. Almost, it was every day. There was
1 to 10.
I would say it was in that 8 to 10 almost all the time. It was bad.
Both in the back and the legs.
The back was really
bad.
Yeah, the leg didn't really bother until after I had the surgery. The moving the nerves around.
Mm-hmm.
But I had some pain going down my leg before the surgery too.
So let's jump to it. We did a surgery about a year ago, and in that surgery we did actually quite big surgery. We did a L3 to S1 fusion, and just now we are a year after the surgery. And the bone is beautifully growing, and we have a fusion. So fusion was successful, but you were one of those people that we tell you have a nerve root irritation.
Yeah.
And as you see here in my note from the surgery, is that you had a nerve root irritation. We document that, and to the left L5. This is the other data of the surgery. The surgery was about 2 hours, and we did 30 cc, we had 30 cc of blood loss, and this was a big surgery, so we had lots of fluoro time. And you stayed in the hospital 2 days. You thought the surgery, how was the surgery? Right after the surgery, how long did it take you to walk?
Well, I was up the same day.
Okay.
Yeah, they helped, and my biggest problem was that the left knee, from the knee down, was so numb. I couldn't feel my leg, so it was low.
That nerve root irritation.
Yeah, so I had a hard time walking. It's hard to walk when you can't feel your leg, but that just slowly got better.
So, and how long did it take for that to get better?
It was real slow. It's just a little bit at a time. But it's actually, been like the whole 9 or 10 months now, and it's just been real slow, a little bit
every month a little better.
Yeah.
Okay. How is it now?
The leg feels good, just the little numbness in the bottom of the foot, and I still get that tingling, so I know that's gonna go away because that's when the nerves are coming alive.
Yeah, exactly. Do you remember us multiple times talking about that there's a risk of nerve root irritation, and we talked about that multiple times before the surgery? Do you remember that conversation?
Oh yeah.
What do you remember? What did I tell you?
You told me that there'd probably be some numbness there, and right after the next day when I talked to you, I said, I can't even feel the bottom of my leg, And you said, well, it's not, that'll get better, and you'll stinging in that, and I have the stinging, and that's the nerves coming back alive.
Excellent. Does it bother you much at this point?
No, I can feel it, but it doesn't hinder me in any way.
And we are barely about a year out of surgery, so it's still going to get better.
Yeah, oh yeah.
And so overall, even though you had I'm taking this video because you're not one of my stellar patients.
Oh.
Because my stellar patients don't have that nerve irritation.
Oh, okay.
But I want to show to people how it is if you have that nerve irritation. Yeah. So overall, was it worth it for you?
Oh yeah.
Okay.
Yeah, I mean the numbness there was a lot at first, and then of course the first couple of months it really improved a lot. And then after that it's a slow process, but better, that part's just
No, man.
If it didn't get any better, I'd live with that.
Now I want to ask actually your wife as well something. Now, how was his life before, and how is his life now? Before the surgery, a year before the surgery, and how is it now? What do you notice?
Well, he can move around now. I mean, then he couldn't sit, he couldn't stand. Everything was painful, where now he can get around.
So many people come and tell me, no, before the surgery, it was their entire life is just going around this pain.
Yeah.
Not only themselves, but family as well. The whole family just working around the pain.
Yeah.
And now, was it like that with you?
Yeah.
And now you're going back to your usual life.
Yeah.
So, so overall, happy with the results?
Oh yeah.
Even with that nerve irritation?
Yeah.
Okay, well, thank you so much for the interview.